Hi everyone, so I've received a question on comparing a few of the myo-inositol and d-inositol supplements. This is one by Ovofolic, or this is Ovofolic by Elanhealthcare, and this is PCOS Care by Bioclinic Naturals. So I'm going to talk a little bit about what myo-inositol is and d-inositol. These are naturally occurring substances in our body. They're isomers of B vitamins, but what's really specific in PCOS, Polycystic Ovarian Syndrome, is that we actually have a deficiency of myo-inositol. So it's actually really important to be taking some kind of supplement that is myo-inositol. And so some of these supplements have d-inositol as well. This is another form of inositol. And what we see with this is because of the ratio that we see in the ovary of myo-inositol to d-inositol, that's why a lot of these supplements will have a 40:1 ratio myo-inositol to d-inositol. And so some of the benefits of myo-inositol include helping support ovulation in women with PCOS, reduction in testosterone, also helping with sugar cravings. Another really important one is egg quality. It can also help with mood. So many benefits when it comes to myo-inositol in PCOS. Now, there's a few differences between these two supplements. This is PCOS Care by Bioclinic Naturals. It has 2 grams of myo-inositol, 50 milligrams of d-inositol. It has some folate in here, so 200 micrograms. So folate is the active form of folic acid, and it also has B12, which is nice because we do know that if you're taking metformin and you end up taking myo-inositol alongside it, it does deplete your B12. So really important to be taking B12 alongside myo-inositol. Ovofolic, on the other hand, it has 2,000 milligrams, same thing as PCOS Care in each scoop. It's 2 grams or 2,000 milligrams, and then 50 milligrams of the d-inositol, and then it has the 200 micrograms of folate as well. It doesn't have the B12, but it can really help that folate for prenatal support if you're trying to conceive, which is oftenly prescribed myo-inositol in my practice when you're trying to conceive. So can you use myo-inositol long-term? Women with PCOS have a deficiency of myo-inositol, so it's actually really important to be using, and you can use it long-term if you have a deficiency. But this is really important to be checking up on lab work to make sure that everything looks okay in terms of blood sugar and HbA1c in order to continue the myo-inositol. So that's what I would say in terms of continuing it long-term. If you have any questions at all about myo-inositol, please drop them in the comments below and check out my other videos on myo-inositol as well. So I should have also mentioned a supplement called Ovofolic. This is a really popular supplement when it comes to myo-inositol and d-inositol supplement out there in a powdered form as well. This one just has myo-inositol and d-inositol. It doesn't have any folate or B12 alongside with it, so you'd have to take that extra. But all of these are pretty comparable. I would say the only difference is some of the extra vitamins that are there, but all the dosing and everything is pretty comparable. Again, if you have any questions at all, please let me know in the comments below, and I will drop some links to some of these products for you to check out.